Welcome, and thank you for joining us for the Regeno Therapy, How the Stomach Benefits from Drainage and Detox webinar. My name is Heather Schofield, and joining us is Lesia Galoida.
Hello, everyone. I'm happy to join you, Heather.
Great. Thank you so much. So for those that don't know me, my name is Heather Schofield, and I'm the Education Director and Medical Advisor here at Biomed. I am so excited to be doing this webinar series with the rebranding of the Drainage and Detox Remedies as the Regeno Therapy, Drainage and Detox Remedies. Tonight, we're going to be talking about bitters and how to improve hydrochloric acid production in the stomach. And with 20 plus years of training and experience, I'm really happy to be here to share my knowledge and wisdom to all of you. And then we have Lesia.
Yes, hello. I'm Lesia Galoida. I'm your professional advisor in Ontario. And as I was fulfilling role of medical advisor for many years at Biomed in the past, I will be really happy today to share with you some clinical perspectives and help you um, sh- to use regenotherapy remedies for different conditions.
Great. Thank you, Lesia. So what we're going to cover in the webinar is a review of drainage and detox specifically for the stomach, talking about bitters and overall why bitters are really important for digestion, and then how you can include more bitters in patient protocols and then also in daily life. We're going to talk about the stomach and stomach function, and then we're going to introduce the very specific regenotherapy remedy absinthium. And this will tie in with drainage and detox for the stomach and also in the bitter category as well. And then we'll cover off on a number of protocols, which include hydrochloric acid production, heartburn, acid reflux, indigestion, overeating, H. pylori, and ulcers. So let's get started. When we are taking the ideas of homotoxicology, which we covered in the webinar last week, one of the things was taking that and creating a more modern understanding of homotoxicology. I'm going to take some time right now to just review again what homotoxicology is and just create some understanding on how that relates to the stomach. So, we are exposed to toxins on a daily basis. That's through the food that we eat and the water that we're drinking. It's through the air that we're breathing, and it's anything that is coming in contact with our skin. A number of toxins are in all of these different ways that they could be entering the body. And our detox organs, which include the liver specifically, the bowels, and the kidneys as some of our primary detox organs, take care of converting the toxins and then having them excreted from the body. Over time, when there's more toxic load coming into the system and getting stored in the body than what our detox organs can take care of, we can start getting toxins kind of building up in our tissues, specifically in our connective tissues, and then can start to cause bigger types of issues within the body. And that's essentially a look at what homotoxicology is all about. So homotoxicology, there's 6 different stages, and the increasing stages represent disease evolution. When we're using homotoxicology principles in drainage and detoxification, what we're aiming to do is help to clear toxic load out of the different tissues and the organs and the cells of the body, and giving the body the opportunity to have like a health evolution or reversing within this 6 phases and getting back into better regulation where the body can take care of itself. And so, a review of the 6 homotoxicology stages or phases includes excretion phase. This is where the body's getting rid of toxins on its own. And it could be through vomiting or diarrhea or sweating or sneezing and runny noses. When we continue to have a toxic load or burden, those toxins can become harder for the body to get rid of. And the body is now using other ways to try to clear it. And that has a base of inflammation with the body trying to clear toxins out of the system. If the toxic burden or the toxic load continues and the body's not able to take care of it, then these toxins start to get deposited, or the deposition phase, where they're getting deposited and stored in the connective tissues. Sometimes there's symptoms associated with this, and sometimes they're not. Once we cross from phase 3 to phase 4, what they call the biological divide, this is when it's starting to actually affect the cells and affect the function of the body's tissues and organs. So, phase number 4 is the impregnation phase, and that's where toxins are starting to move into the cells. And this is often where symptoms are really starting to be noticed. And then we move on to the degeneration phase, where this is where the toxic load is large enough and the body has not been able to clear it. So it's now being deposited into the tissues and the cells, and it's starting to damage the cellular defenses, damaging enzyme function and energy production. So this is when you start to see kind of a chronic severe inflammation and illness or chronic degenerative condition starting to occur. And then finally, you move into phase 6, which is the de-differentiation phase. And this is where genetic damage is caused and often where cancer or neoplastic state sits. When we're talking about it from a stomach perspective and from a hydrochloric acid, heartburn perspective, then let's just review that because that's the topic of what we're talking about tonight. So, phase 1, or the excretion phase, is heartburn, where the body is trying to excrete the excess acid. As we continue through in the inflammation stage, that's where you're going to see inflammation of the stomach, so gastritis or gastroenteritis. As you continue onto stage or phase 3, hyperplastic gastritis. So this is when chronic inflammation is setting in because there's the inflammation happening and there's changes in the hydrochloric acid, so less of it. You can start to see H. pylori colonization, so increase amounts of H. pylori, polyps, and it also can include some symptoms like nausea, vomiting, or some intermittent pain. When you move on to phase 4, then you see a chronic gastritis, so chronic inflammation of the stomach. Because of that inflammation, there's malabsorption of vitamins and nutrients and B12 and iron and protein. H. pylori really settles in, and so H. pylori can also then be increased and in their colony and start to cause H. pylori infections and symptoms. This then also is related to pain that is not coming and going, but often can be there as a persistent pain, vomiting, and a lot of feeling of fullness. As you move into the degeneration phase, this is where you start to see that damage happening in function. So there's an atrophic gastritis, which includes a thin, damaged mucus. That again is very related to increased H. pylori in the stomach, colonization, causing symptoms. With a thin, damaged mucus, ulcers can start to play because you don't have the mucus protecting the stomach lining from the hydrochloric acid. And then there's also poor hydrochloric acid production and enzyme production, which also is leading to malabsorption. And then in that phase 6 is the stomach cancer phase, or where stomach cancer can show up. So, what we want to be talking about then is what can we do from a homotoxicology, drainage, and detox perspective that is going to be allowing the stomach and the hydrochloric acid and the digestive juices to be able to function the way that they need to function. And what can we do as far as drainage and detox? So if somebody is further along in the phase for homotoxicology, can we add something in or a protocol in to help do some repair, some regeneration, to get the hydrochloric acid production back kind of on track into normal range, and then reverse if there's stomach inflammation and heartburn, kind of back into a better health state. So that health evolution. And that's what we are going to explore through this webinar. Okay, so let's talk about the stomach and have a better understanding about that. So the stomach, its optional function is really a key for all of digestive health. The stomach is, while the mouth is at the very top of the digestive cascade, the stomach is where a lot of things are really happening. And hydrochloric acid is a really big part of that. When hydrochloric acid production is compromised, then all kinds of symptoms can start to occur. And that includes things like heartburn, gas and bloating, H. pylori or parasitic infections, poor protein digestion, and poor binding and ketylation of vitamins and minerals. So vitamin and mineral deficiencies can also occur. The stomach, its function is to churn food, to start to mechanically break things up, and then also to be secreting different digestive juices to help start to break down protein. There is some fat that is also absorbed, like fat digestion is started in the stomach as well. And then there is other things to support B12 and iron and some of the minerals as well. So the stomach has the mucus layer that's protecting the stomach lining from the hydrochloric acid. And then it also produces pepsinogen and gastric lipase for the digestion of proteins and fats. It also produces intrinsic factor, which is necessary for B12 to be absorbed. This is often why we talk about using a sublingual B12 in the methylcobalamin form or the biologically active form. And when you use a B12 sublingual, it goes and absorbs directly into the bloodstream under the tongue, and it bypasses the stomach and digestive absorption issues. And so it definitely for people that are having any sort of stomach issues or stomach function type issues that we're going to be talking about tonight, consider the B12 folate as an alternative option to make sure people's B12 levels are at their optimal levels. Okay, through that digression, let's get back. Normal hydrochloric acid production, it's needed to convert pepsinogen to pepsin, which is used for protein digestion, mineral and ketylation and absorption, iron absorption. It helps to get the pancreatic enzymes and bile moving and flowing. And then the other big part, which is really important, is hydrochloric acid is essential for controlling and killing different bacteria and parasites, especially the bacteria or parasites that's coming in on the food that we're eating. Having a really acidic hydrochloric acid then helps to kind of destroy the bacteria. And so we don't end up inherently getting more bacteria in the gut or getting sick from it. So, with the indications for low hydrochloric acid, these are the types of things you would see in clinical practice, or the things that your patients and clients would be coming to you for, and talking about having heartburn, acid reflux, or GERD. So that's like a gastric reflux. Indigestion, so feeling like they're not digesting their food very well, or food sitting in the stomach and taking a long time to digest. A lot of belching and burping after meals, gas and bloating after eating, seeing undigested food in their stool, constipation or diarrhea. Of course, constipation and diarrhea can be associated with a lot of different things, but in the bigger picture, if there's that plus other things, it could be, again, pointing to a low hydrochloric acid. Leslie is going to actually spend some time really talking about the connection between low hydrochloric acid, bile, and constipation to help, create a better understanding for you. Also, having trouble digesting meat. And that reason is because hydrochloric acid is essential for converting pepsinogen to pepsin, which helps to break protein down. And so if people are having a hard time digesting meat, then it could be a really clear indication that the hydrochloric acid is low. And then this is going to create protein deficiencies. And it's also going to create something called protein putrefaction. It's not even fermentation at this point, it's a putrefaction. So the protein is basically kind of breaking down and putrefying in the gut, and then that creates this incredibly smelly gas. So it's not just regular gas, but it's gas that really has a garbagey kind of really, really smelly smell to it. And that really can point to poor protein digestion. Food sensitivities and allergies can be connected. Of course, we talked about infections, so bacterial infections, SIBO, parasites, H. pylori. There can be a fatigue component to it. And because of the mineral deficiencies, you can also see brittle hair, brittle nails, osteoporosis. And then the vitamin and mineral deficiency component, again, you need hydrochloric acid to help with absorption with iron, zinc, copper, manganese, calcium, and magnesium. Those are all very essential minerals for overall health in the body. Uh, the iron deficiency, again, that is due to lack of hydrochloric acid. The B12 deficiency can be due to low intrinsic factor, and the protein deficiency due to low hydrochloric acid and not converting pepsinogen to pepsin. And so you can see hydrochloric acid, while it's one thing, it can lead to so many things. And again, this is all at the top portion of the whole digestive system. If there's a problem happening in the stomach, then this is going to cascade through the entire digestive system. So it's really important that the stomach is paid attention to with our patients and our clients. Now, I've got a few slides here that are talking about the stomach in the sense of kind of anatomy and physiology. Mostly they're here for your reference. I did want to just cover a couple of things and bring your attention. So this is an example of a stomach kind of wall. And so you've got the mucus on the top, and then you have the gastric, what they call the gastric pit, and the gastric glands. Inside these gastric pits and glands are where the parietal cells and the chief cells reside. And so there's a nice chart here on the right, and it talks about what the different cells are and what they secrete. So mucus cells, of course, secrete mucus, and that creates a very alkaline barrier so that the stomach acid or the hydrochloric acid is not eating through the stomach wall. The chief cells are important because they secrete pepsinogen. And then the parietal cells are really the most important when we're talking about drainage and detoxification, because they're the cells that secrete hydrochloric acid. And they're, of course, hydrochloric acid is very acidic, and that low pH helps to activate pepsin, which is going to break down the protein or the amino acid chains. It also is what's killing the microorganisms. And then the parietal cells also secrete intrinsic factor, which is needed for the vitamin B12 absorption. And then just kind of as a last point, the D cells, they secrete something called somatostatin. And so once the stomach has emptied and everything's moved into the small intestine, then hydrochloric acid is inhibited. So it's not going to continuously release. So that's what the D cell role is in all of this. Okay, so just one last chart here about hydrochloric acid and pepsinogen. So again, the chief cells are secreting pepsinogen. The parietal cells are secreting hydrochloric acid, which is helping to convert pepsinogen into pepsin. And then the pepsin is what goes and helps to break down the chains of proteins into smaller peptide fragments and amino acids. When we talk about the parietal cells, because I did mention that's a really important cell, this is where the drainage and detox remedy absinthium, which Lesia will be talking about shortly, is playing the major role in helping to support parietal cells to secrete hydrochloric acid. So that's how we're going to tie all this kind of more scientific anatomy physiology with the drainage and detox remedies. So now we are going to start to move into these drainage and detox remedies. And so absinthium, it is a very traditional stomach and bitter formula. This formula has been used for 60 plus years as a digestive aid, as a bitter, and to help get the hydrochloric acid production happening in the stomach and in the parietal cells. We're going to be talking a little bit more about bitters and how they also support the liver, the gallbladder, and bile production a little bit further on. So I know we've said this point and we'll probably repeat it a few more times. The low stomach acid, it starts a negative cascade that affects the entire digestive system, leading to incomplete digestion of proteins and fats and poor vitamin and mineral absorption. So it's really important, again, that we pay attention to the stomach. When we are thinking about the mechanism of action or how this all works, then a big part for absinthium and how it's working as a drainage and detox formula is it has bitter herbs in it. And these bitters, what they do is they stimulate the taste receptors on the tongue that taste bitter, and they trigger something called the cephalic phase in digestion. And that cephalic phase, it's the first part of digestion, and it is about seeing food, smelling food, tasting food on the mouth. It can also be about thinking about food, and it gets 1/3 of the digestive juices moving. And so this cephalic phase, whether we're tasting it or we're seeing it, it's going to help the secretions with saliva, gastric acid, insulin, and digestive enzymes and bile. And all of this is mediated via the vagus nerve. So the vagus nerve is also super important, kind of in the whole mix of everything. In absinthium, we have three bitters that are incredibly strong, powerful bitters. Gentian is the first one, and it's actually classified as one of the most potent bitters used in herbal medicine. And then we also have wormwood and blessed thistle. And so in absinthium, in addition to some other ingredients, we've got some really strong bitters that help to trigger the digestive response and also to trigger the hydrochloric acid getting produced in the parietal cells. And so now we're going to move over to Lesia.
Yes. So, yes, absinthium, it's a classic drainage remedy because it does fill three criteria. So it has the biochemical effect due to bitters. It has the affinity to the stomach. So we, in drainage, we always have herbs that have affinity to specific organ, and we can recognize the herbs, good for liver, good for kidney. Absinthium, it's amazing remedy for the stomach. And also the third criteria is to increasing circulation, meaning improving the function. So therefore, all those ingredients transform into the action, as Heather has mentioned, activation of the vagal nerve will stimulate secretion of the hydrochloric acid and digestive juices. So obviously, it will be indicated for things that are affected by the lack of HCl, like heartburn, acid reflux, indigestion, hurt. Also, bitters stimulate the appetite. We do recommend to taste the absinthium. You can dilute with the water, but it's also nice to taste in the mouth because all the receptors get activated and the bitter taste stimulate the digestive juices going and you feel hungry. So those who need to boost their appetite, and there are people who need to suppress, but there is also people who need to boost appetite. This is a great remedy to use. Also, herbs have the anti-inflammatory effect, so obviously we can use for the GI inflammation, and as improving the function of the stomach improves digestion, we can use absinthium for gas, bloating, and feeling of fullness, and so on. So I will be talking a little bit more about the conditions, but we can use absinthium for acute when we need some bitters to move the food from the stomach, kind of boost the digestion. We can use for chronic when we need to reestablish hydrochloric acid production. And we can also use as a digestive aid. As Heather was mentioning in the previous webinar, that the drainage have 20 minutes period of time to really have a great to act. So if you take absinthium 15-25 minutes before meals, you are actually boosting the digestion of the heavy meal or the food that you're not eating very regularly. Next one. So my goal today is also to transform the knowledge that Heather is presenting to you into the clinical applications, and to show you, to demonstrate how hydrochloric acid is important for as a root cause for many other conditions that patients will present to you. So just to oversimplify things, digestion, it's a process. So it starts in the mouth. So we chew our food. It goes down to the stomach. Hydrochloric acid break down the protein and chelates minerals. Then the liver get involved by producing and releasing the bile to further emulsify fats, make them water soluble, prepare for the further digestion. And in the small intestine, we have pancreatic enzymes released and activated that will ensure further breakdown of nutrients and their assimilations. So as it's a process that every phase depends on the previous one. And stomach digestion in the stomach, it's quite important because if you have a low hydrochloric acid, first proteins, incomplete digestion of the protein will lead to the fermentations. And when your patient are presenting symptoms like bloating and flatulence, and they see undigested food in the stool, yes, we can recommend some of the colon cleanse, we can recommend digestive enzymes, but we are not addressing the root cause. We know that it's much higher, that the digestion was failed. So by stimulating hydrochloric acid production and assuring that we have a proper amount of HCl for each meal to be digested, we're actually ensuring that first phase of the digestion is completed and now the food is ready for the next one. So from the stomach, foods move into the duodenum, and the food mixed with the digestive juices called chyme. Because it's acidic, it cannot go into the small intestine to be further absorbed. We need to neutralize. And this is actually the function for the bile. Bile is very alkaline, strong alkaline substance. And beside emulsifying the fat, it has a very important functions to neutralize the acidity. So it's safe to move into the small intestine when the lining is very gentle and not adapted to acids. So when we have a strong acidic chyme, then it will call for sufficient amount of bile. And you see how it's connected? Proper stomach acid will also call for the release of bile, ensuring that bile salts will do the emulsification of fat, and they also work as stimulators for peristalsis. So for food to move further and to prevent the constipation. So we are coming to constipation. Many patients will come to you with the constipation as one of main symptoms, and they're telling you, I'm eating enough fiber, I'm drinking enough water, I take digestive enzymes, and I still have to take a lot in order to have a proper bowel movement. In a healthy person, bowel movement and peristalsis ensured by the irritation of the mucosa and the muscles with the bile salt. So here we have proper HCl, proper bile release, then proper peristalsis. So you see how it go cascade. One step depends on another. Also, one more things about the digestion is the pancreatic enzymes. They're important and they're released by pancreas in the small intestine, and they further break down fat with the lipase and protein with protease and carbohydrate with amylase. But those enzymes need to be activated and they're pH dependent. So if you have a proper alkalizing effect from the bile, then digestive enzymes will be activated, ensuring the optimal absorption and assimilation of nutrients. That's regarding the digestion. Regarding the protective mechanism of HCl. So, we will be talking about the Helicobacter pylori later on, and ulcer. But as Heather has mentioned, we are eating vegetables, salads, and contaminated, probably contaminated with different microorganisms every day. And we don't get infected with the parasites every day. Why? We have a proper gate. This is the stomach acid that will denaturate any protein. And if it's a worm, it's simply for our body, it's a protein. So we need to just digest. And this is how we're protecting ourselves from any food poisoning, from any parasites from the water, from the food. Yes, sometimes it's not enough if it's, food poisoning can happen when it's a lot of bacteria in one time, but not if we kind of keep up the food hygiene. Another reason for the parasites, like protozoa, they have the lipid layer. So this lipid layer is not destroyed by hydrochloric acid, but as we have a sufficient amount of hydrochloric acid, remember that we are calling for sufficient amount of bile. So the bile will finish up what hydrochloric acid didn't. So I was kind of surprised, like when realizing that when we are taking bitters, we are not actually use them to kill bacteria, to kill worms, to kill protozoa. We're actually stimulating our own defenses. We are stimulating bile, we are stimulating stomach acid, and this is what kills and protects us from parasites. So, see, it's a more holistic approach, and we are actually improving our own defenses, our own healing mechanisms. Next one, please. Um, for realizing that stomach acid production is super important, we can use absinthium, and also heartburn, acid reflux. It's a sign of the hydrochloric acid, of the low hydrochloric acid. Many patients have this, obviously they're not the practitioners, they have this idea, if I have a heartburn, I have too much of the acid. Obviously, we as a practitioner, we understand the physiology, and I always oversimplify things that you can, relate this to your patients. When you have low acidity in a stomach, the food stays in a stomach for much longer than it's supposed to. There are receptors at the sphincter pylori. It's the gate between stomach and the duodenum. So it cannot allow the food that it's not ready to move. So the food usually stays in the stomach for up to 2 hours. But if you have low acidity, it will stay for much longer. And it will lead actually to fermentations, to food is expanding and stomach is expanding, and the patient can attest that yes, I feel heavy in the stomach, I feel bloated in the stomach, and I feel I have some burp with the undigested food and so on. So obviously when the stomach expands, the sphincter, there are two sphincters. One on top, it's the lower esophageal sphincter, and the acid that's not supposed to go up to the esophagus actually comes in, and our esophagus is not supposed to be in contact with acid. That's why we feel a burn. So once again, we can take some symptomatic relief, which are alkalizers, and address symptoms. But if you want to address the root cause, we need to improve the digestion and assure that food evacuated are in a timely manner. And for that, we need to boost the production of hydrochloric acid, and we can achieve this with the absinthium. We do recommend also provide a proper acid-base balance in the body. And you can use basic tabs, basic powder or alcala, and those will have two functions. First, as an alkalizer containing baking soda, calcium, and magnesium minerals, different minerals, they will give symptomatic relief for the heartburn, but they also provide the minerals for the HCl and the bile production. So we can expand more about the improving stomach acid. Heather can talk about this in the details. And for me, I just want to summarize saying improving hydrochloric acid has much more clinical applications than just improving digestion, as it cascades into the entire digestion process. And I also want to remind you, I'm sure many of you know this functional test. It's a testing stomach acidity with the baking soda. It's a wonderful tool for you to give to your patients as a homework. It has a couple of benefits. First, you are involving your patients in a process. Second, the patients, when they do the test, they will see the results and they will be motivated to improve those results if they're having, low acidity. And third, the patient can take this test anytime, doesn't cost any money. You just need water and baking soda, and you can do anytime, and they can monitor the process of their healing. So if they have a negative results first time, and after the treatment they do the test again, they see the improvement, they will be definitely happy to report back to you that your protocol works. So how do you do the test? Simply, it's the reaction between your stomach acid and baking soda. You need 1 cup of cold water and quarter teaspoon of baking soda, and also a timer. Baking soda could be, from without the preservatives, or even regular one will work. Cold water is important because when we drink cold water, it will stay in a stomach long enough until it's warm up to the temperature of our body, 36.6 Celsius. So if you drink warm water, it will quickly be evacuated from the stomach. So it will defeat the purpose for this test. So you take 1 cup of cold water and baking soda. You can mix it, but I prefer to take it in the mouth and then just follow with the water. At that time, you start the timer and you record the time for the first burp. Obviously, this is the chemical reaction when HCl with the sodium bicarbonate, and as a result, you have the carbon dioxide, the gas, and that's your burp. So interpretation is very easy. If you burp in less than 2 minutes, you have strong stomach acidity. It's normal, it's healthy, great. However, if patients have so many symptoms that we were saying that indicates low acidity, they might have a burp between 2 and 5 minutes. So it's a low, kind of on the low side. Burp after 5 minutes indicates low stomach acidity. I used to have patients who will take this test in the morning, will drive to work, and half an hour later will have a burp. So obviously they will be just saying, "What do I do? What do I do? How do I change this situation?" And this is when they're really willing to take matter in their own hands, improve things, and we do have the tools to help them with absinthium and other remedies, obviously. Thank you, Heather.
Great. Thank you, Lesia. Okay, so we are going to talk about bitters, and then we're going to go into a few more protocols with some additional uses for absinthium. And so the purpose of this slide really is to let you know that a number of the Regeno Therapy formulas actually contain bitters. We've talked about the bitters in absinthium and the importance with the hydrochloric acid. And the other liver gallbladder remedies that were presented in the webinar last week also have bitters in them. So A. hepatica, it shares wormwood and blessed thistle, the same with absinthium. And then in addition, it's got chicory and bitter orange. It's not actually the orange. It's a botanical opposed to the actual skin of the orange. So in bitters and A. hepatica, they are functioning in that very similar fashion where it's getting the digestive juices, hydrochloric acid and bile kind of stimulated and flowing. In Cardis, which um, is really about bile and really focusing on the gallbladder and also a really big focus on constipation, it contains a completely different set of bitters, which include Culver's root or Leptandra, Chelidonium, dandelion or Taraxacum, and barberry, which is also berberine or berberis. And these specific bitters have a very direct effect at getting the bile flowing. And then finally, we've got Incardinera globe artichoke, and it is classified kind of as a broad spectrum bitter. So it's working on the digestion and digestive juices and also the bile, and really kind of getting the liver and the gallbladder woken up as well. So we've got a really nice array of different bitters available in the 4 different formulas. All right. And so just as a quick overview, since we did cover this last webinar, with the bitter part, so for A. hepatica, Cardis and Cardinera, the actions of the bitters. So in A. hepatica, it's a digestive aid, it stimulates the appetite, and it gets the bile flowing. And again, it's really used for liver detoxification and secondarily gallbladder detoxification and getting that bile flow going, in addition to supporting the liver to do some actual detoxification of toxins out of the system. Cardis, its digestive bitter, focuses on the liver and the gallbladder as a tonic and as a stimulant. Its real focus is about bile flow, and it has a digestive aid and a mild laxative component to it, which is partially why it's really called for as an addition in any constipation protocol. And its big role here again is improving bile flow and bile secretion. And then finally, Cardinera, which is the globe artichoke. It stimulates the bitter taste on the receptors, so it's kind of getting all the digestive juices flowing. Again, it's working on the liver, especially if there's a picture with high cholesterol. It works really to increase the bile production and the bile flow as well and stimulate fat digestion. Okay. And so we are going to now talk about some specific protocols that involve absinthium and involve the stomach in general. And so the first one is talking about how to reestablish normal hydrochloric acid levels in the stomach. Throughout the webinar and the presentation, I hope that we've made it very clear about what we're going to do and how to do it. And so this is, again, very similar to the heartburn protocol in helping to reestablish the hydrochloric acid levels. And that really is absinthium. Absinthium is the star in all of this because of the bitter component. But in addition, in that biochemical effect, what absinthium is doing is it's stimulating the parietal cells in the stomach or in the gastric pit to secrete more hydrochloric acid. And so it's absinthium is helping to increase hydrochloric acid production and normalize it within the stomach. You take the 30 drops before a meal, somewhere like 15 to 20 minutes before a meal to kind of get everything moving. And because if it's somebody with low stomach acid, and if they're using that burp test to, give a signal as to where the stomach acid is, the drainage remedies, we don't just use it for one dose or one day or, for 1 week, but instead we're looking at up to 3 months to really support getting that hydrochloric acid production re-regulated in the stomach. Now, there's one other component to it, which is really important. And for those of you that have been with Biomed, also know we really do support a lot about the European biological medicine. Of course, this all fits in there, but the acid-base balance component, when the acid-base balance goes out of balance, then the pH changes in all the tissues. And actually, acid-base balance is part of the low hydrochloric acid picture. And so using an alkalizer will help to provide the raw materials to actually make the hydrochloric acid. So sometimes the hydrochloric acid production is low because the body doesn't have enough bicarbonate in the system to supply the chloride and the hydrogen molecules in order to actually make hydrochloric acid. So that's a big part of what an alkalizer is doing, is supplying those raw materials to help make more hydrochloric acid. And then you're using absinthium to get the parietal cells to also be secreting and producing it as well. So that kind of combination, using that for kind of 1 to 3 months in probably the 2 to 3 month range, you can reset somebody and get the hydrochloric acid levels getting close to normal production. And then finally, if somebody needs that extra digestive support because the digestive enzymes aren't working or functioning as they could, or the digestive juices aren't stimulating the enzymes from the pancreas, then you can add digestozyme in there. It does have high amounts of protease to help support protein digestion while you're working at getting everything on track. And then the last thing, of course, is to remember about the diet. So lots of alkaline foods, less acidic foods, limit stimulating foods and caffeine and alcohol. Try not to eat huge amounts of animal protein. Avoid the processed foods. All raw fruits and vegetables should be before noon because the pancreas's strong time is 9 a.m. And so only eating kind of at the time where the body can handle it, but after noon, everything should be cooked. And then, of course, staying away from all the common allergens. Okay, so Lesia is going to talk about H. pylori, and then a protocol for H. pylori, and then finally we'll talk about overeating, and then we'll do a summary of everything. So when H. pylori is showing up, H. pylori is part of the natural flora and fauna that exists in the stomach. And with that H. pylori, the one thing to know is you may ask that question, how did I even get H. pylori as part of my normal flora and fauna of the stomach? Well, H. pylori is passed from mother to baby. So if the mother is chewing food or sharing food with the infant, that is essentially the inoculation of that species into the gut or into the stomach. So, okay, I see Lesia online, so
Yes,
we'll pass
yes.
it over to
Somehow,
her.
I'm sorry, there was some internet disruptions.
Yeah, no
Yeah,
problem.
actually, Heather, more than half a population on Earth have the H. pylori in a stomach. Yes, the people get infected in the childhood, and social economic factor plays a role, and hygiene plays the role. But now, obviously H. pylori is the problem in also in the developed countries and in the modern world. So. Um, so we have patients here in Canada who suffer from H. pylori infections and ulcer and so on, and we need to help them. So H. pylori was discovered by Barry Marshall and Robin Warrens, and they got Nobel Prize in Physiology for discovering that bacteria in 1980s. Before that, ulcers were treated just by suppressing the stomach acid, and after this bacteria was discovered, antibiotic therapy was developed, and now it's used very wisely. Uh, in one way, it's the as we were a little bit as we were converted by biological medicine, we Heather and I and practitioners who practice biological medicine look at the bacterial infections a little bit differently. Yes, bacteria overgrowth is a fact, but also environment is very important. And for the and I will tell you. like you can use your logic as well. If you come and see the fire and the fireman and fire truck is present, doesn't always indicate that firemen are the reason for the fire. Same with the H. pylori. It's not always when H. pylori is present, it's the problem for the gastritis and ulcer. I think when we're looking more from the physiology perspective, when we have a proper hydrochloric acid, when we have a proper function of the stomach, then bacteria will be present, but it will be not opportunistic. It will not take advantage of us. It will not create the pathology, in this case, gastritis or ulcers. And for that, you have to understand that the symptoms. So when the H. pylori comes in the stomach and the lining is proper, we are protected. We are protected by the mucus in the stomach. We are protected by the HCl. So H. pylori actually is very resistant to stomach acid, and it has a mechanism to protect itself. And that mechanism, I remember some of our teachers were explaining, it's like an ammonia dome. So H. pylori comes to the surface, to the mucous membrane, and it emits the enzymes that will be transformed into the ammonia, and ammonia is alkaline, so it will neutralize the stomach acid, and will kind of ensure the environment when the Helicobacter can penetrate through the mucous membrane into the deeper layers. And when it's in the deeper layers of the mucosa, now the HCl, hydrochloric acid, will be not able to destroy it. So yes, it has for that reason, proper hydrochloric acid plays the role. But we do need also to realize that when it's overgrowth and when we have already infections and damaged layer, we will need to employ a little bit different remedies beside the absinthium. So when patients have pain, burning, or pain usually worse on an empty stomach, loss of appetite, weight loss, heartburn, frequent burping, nausea, all those symptoms that kind of worrisome, they go to the medical doctor. They identify this as a H. pylori infection, and allopathic approach is triple therapy. It's antibiotics, it's to lower stomach production, and antifungal. So I can understand killing the bacteria, but it's unfortunately we are not able to do that. It's too expensive to kill all H. pylori in the world. So yes, we can diminish the number, but patient can get reinfected. That's the fact. Reducing the hydrochloric acid. We just spoke for half an hour how important hydrochloric acid is for digestion, for assimilation, for protection. So it's kind of counterproductive and against our physiology. And the third therapy, it's antifungal. It's already assumed that this antibacterial therapy will lead to change of microflora and will promote fungal development. So what are the benefits of this allopathic approach? But obviously patient is suffering, so we do have the better alternatives. Next slide. So for that, we need to address a couple of things. If allopathic medicine say reduce the stomach acid, we are saying let's promote and bring HCl to optimal level. So for that, we can use absinthium, and it will be a great way to reestablish HCl. Unfortunately, it could also, when we're stimulating stomach production, even though absinthium has anti-inflammatory and healing properties, it might be a little bit discomforting. So we do need employ some herbs that have the protective, soothing properties. And actually, we do have a product called GastroEase, and GastroEase, beside The antibacterial agent that I will be talking about in a second has the German chamomile, marshmallow, sweet fennel, and the glyceride licorice that exactly cover that our needs. Be anti-inflammatory, be soothing, be healing, and be protective. So, as we already have H. pylori overgrown and already involved in the process of ulceration, we need to eradicate it. So for that, in Greece, mastic gum was discovered. In Greece, it's a traditional use for the. It's a resin that derived from plant Pistacia lenticus, and this resin is very strong antibacterial and has strong antibacterial properties. But on a good side, it's actually very safe and has no side effects. You can use safely for minimum 3 months and there will be no negative effects. So instead of using antibiotics, we can use mastic gum, and which will be affecting H. pylori. And at the same time, we will be reestablishing the hydrochloric acid production and protecting the mucosa. So, and yes, because it's already kind of mucosa, it's sensitive, inflamed, you do feel heartburn, you do feel a little bit discomfort. So, we do recommend using alkalizing agent like basic tabs. This is in a tablet form for those who don't like the powder, or Alcala. Alcala, you need to have acquired taste for that, but its immediate effect when you feel heartburn or when you feel kind of discomfort. So this is what we need to understand, that H. pylori, it's present, and H. pylori will be opportunistic only when the environment permits. So holistic approach, change the environment, improve the stomach acid, decrease the number or the decay with the mastic gum, which is does not cascade into the destroying microflora in a gut. So you don't need harsh therapy, antifungal, and you will need to. You don't need to reestablish all the microflora in a gut. You're kind of preserving intestinal microbiome, but you are effectively eradicating H. pylori. And also for the it's important not to use H2 blockers, which are, drugs for lowering HCl, because at the end you will have incomplete digestion. You can further have the inflammatory process in the stomach, and as I was mentioning before, if the first step is incomplete, the rest of digestion will fail. So Gastrus is available at Biomed and Absinthium. You have to follow the dose. You need 2 capsules between or before meals 3 times a day, or sometimes higher. But at least you will not experience any harsh side effects as you would experience with the allopathic therapy. And obviously, we have to manage the stress. We do have a great remedy from Regeno Therapy, Avena Sativa. It's a great calming remedy for nervous system. Obviously, in terms of the diet, we want to be gentle in terms of the food. Don't go with the spices. Don't use inflammatory foods. Use maybe even mechanically altered food, like some puree, some soups, and you don't want to eat steak when you have the acute inflammation. But overall, will be as effective as a traditional allopathic approach. And in terms of the indigestion, once again, nothing new. We are using absinthium and absinthium is the bitter, so it will stimulate the acid production, stimulate the digestive juices, and also it's great to be used as kind of a your remedy for vacation overeating protocol when we are going on an all-inclusive and you want to try everything. This is a great remedy to use. Actually, I saved a couple of vacations for my family because I always take absinthium with me when I'm traveling, because sometimes it's the fresh food looks fresh, but it's not really fresh food. So when you have the just the first kind of symptoms, it's good to take it. And wormwood, being not only bitters but being antimicrobial, antibacterial, will actually take care of any food poisoning in the initial state. And we do have a great digestive enzymes, biozyme and digestizyme. Digestizyme is more powerful than biozyme, and it's great to use it as needed. And I want to also mention to you, maybe some people will say, "Oh, I don't want to take digestive enzyme because I don't want to suppress production of our own." Actually, this rule for replacement therapy, it works only on endocrine system, on hormones. So when we have a thyroid issue and we're taking thyroid hormones externally, we are suppressing thyroid function. Uh, we are doing the replacement therapy because it's endocrine. When we take some corticosteroids, we are suppressing production of our own. But it does not happen with the enzymes because it's a exocrine function. So it's like a sweat, like a tears, like the saliva. You drink water, you don't suppress production of saliva. You drink water, or in the heat, you're not suppressing your sweats. So same with the enzymes. It's safe to take and replenish them as needed when we overeat, when we feel kind of discomfort. Obviously, we are aiming to address the root cause, but the digestive enzymes are great support because with age, our amount of digestive enzymes are kind of diminishing the quantity. So it's good idea to supplement so we can have our own enzymes for repair and for repair and digestion for much longer.
Great. Thank you, Lesia. So we're going to summarize everything. And just before that, I have one thing to add to this. In the overeating component, it can happen, especially during holiday times and family meal times, where, as Lesia said, you want to taste a little bit of everything. And then you have the dessert and you have the appetizers and you snacking, and it's definitely a lot more food. And so then you end up with that discomfort because you're overly full or too full. You can use absinthium at that time to kind of get things moving. And so it kind of does a kickstart of digestion and helps the body to start being able to digest all the excess food that is sitting in the stomach. So it can be used kind of in that symptomatic stage to be able to really support things. And adding a digestive enzyme at the same time can definitely kickstart and get that turkey from the holiday meal moving through the system. And I've used this many times, just even in my own family gatherings, to kind of get people up off the couch because they've eaten way too much and are now too full. Okay, so then we've got one more slide here. Just as a summary slide, so back to why use regenotherapy in daily practice. And as we stated before, it is essential drainage and detoxification for every patient and every practice. And it's especially essential when we're talking about digestion and hydrochloric acid production, which is at the beginning kind of the whole cascade of digestion in general. And so thinking about drainage and detox, Of course, seasonally, this is a really good time to be thinking about it. And we're going to be sharing a lot more in the next webinar about that. And then so specifically here, like those heartburn, acid reflux type patients, which you all have, absinthium is something that could be added into a protocol you're already using or to be building a protocol for them. That indigestion and overeating, the dysbiosis and candida, the H. pylori cases or the ulcer cases, or they've had ulcers in the past. And just to remember, it can also be used very acutely, absinthium specifically. So if somebody maybe um, doesn't have heartburn and their stomach acid is pretty good, but every once in a while they experience some kind of burning, then they can use it symptomatically to relieve, and it's within 20 minutes it's acting. So that part is really helpful. That's with the drainage and detox remedies in general, 20 minutes for action. Heartburn specifically, we'll be talking about allergies and sinusitis next week in that case as well. And then just increasing that circulation to the organ, you are promoting organ function and you're helping to support the body to eliminate toxins. And back to the homotoxicology chart, as we are starting to clear toxins from the tissues and from the organs and from the cells, you're getting the body back into being able to have less in the bucket of the toxic load and then be able to handle things and clear things out more in their in a self-regulatory capacity. Um, and so yeah, Regeno Therapy, these formulas, they've been around for over 60 years. They've been used across the world. They've been available in Canada for the last 22 years with really incredible success with our Canadian practitioners. The protocols are very effective and they're really easy to use. You can use it in a variety of ways, prevention, acutely, symptomatically, or for chronic conditions, especially like what we talked about today with some of the heartburn and gastritis type stuff. We're looking at addressing root cause, not just putting a band-aid on symptoms. And that root cause part, because toxic load and toxic burden in the tissues definitely is a component of root cause for symptoms and dis-ease. The other benefit is that they're safe for all ages, they're non-toxic, they're non-allergenic, and there's either none or very minimal side effects, depending on the case and the patient. And last, with the Regeno Therapy remedies, they're very straightforward. We really, emphasize that tonight. If somebody's got stomach symptoms and digestive symptoms, then absinthium is your remedy. It doesn't have to be in big combinations of different things. Like often you're looking at one or two things in order to really be able to enhance a protocol for that patient. And with all that said, I thank you. Thank you for joining. Thank you for listening. Thank you for Lesia for sharing all your wisdom and practical experience. And we really look forward to having you as part of our final webinar next Tuesday, which will be covering the rest of the Regeno Therapy, drainage, and detox remedies. I see that there are a number of questions that have come through. So the plan is to start answering them for you. So um, type them in if you've got questions and we'll do our best to try to answer them for you. So, okay. So we have a question here regarding the remedies discussed from last week and this week, both homeopathic and botanical. Can they be given to pediatric patients? So the first answer is yes, they can be given to pediatric patients. Sometimes it really depends on, there's some remedies that you have to have more caution with, and there are some that are more of a no. Any of the homeopathic ones are definitely a yes. And basically with the dosing, and we can, if you want to talk about very specific things, then we can email or we can jump on a call to do that just one-on-one. So generally with the drainage and detox remedies, the dosing that we have is an adult dosing. So if a child is 6 to 12, then they would do half the dosing. And if they were less than that, they would do a quarter of the dosing. So that typically is what you're looking at. Sometimes when they're like 1 or 2 or 3 years old, you would just do 1 drop per the year of age, and do that once or twice or 3 times a day. Um, for an 8-year-old, these are definitely not too concentrated. Um, and so again, it would be good to like know kind of what's going on with the 8-year-old, but yeah, with the regenotherapy remedies, in for most of the remedies, not hydrosis nasal spray for kids, but the liver remedies, the kidney remedies, Solidago is great, Lymphodrop is great for kids. Absinthium, you'd only use it if it was very, very clearly indicated, and even A hepatica is also safe for kids as well. Um, okay. So the next question is, can gentian be too stimulating for some people? This is a good question. The one thing you need to remember is that these remedies are in combination with many different ingredients. So it's not just gentian all by itself, and they all are in different amounts within the formula. And these formulas have been designed in a very intuitive way so that you have certain things working with other things to be supporting the entire system, so the organ or the system of organs. So with absinthium, because gentian is part of the larger formula, and there's many other ingredients with it, it is not generally seen as being too stimulating for people. It's also recommended to put it in water, and then hold it in your mouth before you swallow it. So then you're doing another aspect of dilution as well. Leslie, do you have anything to add to that one?
Not to this one, but I will be happy to answer. How long do you recommend the one to
Okay,
take
sure, sure.
absinthium?
Okay,
Yeah.
take that question.
Yeah, because I was just recommending to use the stomach acid test. So if it's for the reestablishing HCl in a stomach, obviously it will take time, and we don't know how quickly the body will respond. For that functional test that does not cost money, you can offer this to your patient. Let's do them test before, use for 6 weeks or so, one bottle or two, and then take a break for a day and do test again and see how you improve. So if they see tremendous results, they feel well, and they see they burp in less than 2 minutes, then absinthium can be taken occasionally for the symptomatic support, like from time to time when there's heavier meal or protein-rich meal. But if they don't see the results, like if they don't see the progression of the healing process, they can take for longer. So you can take from time to time break. And I was also thinking, betaine hydrochloride in the beginning can also be useful, but betaine hydrochloride is the precursor for HCl. So it's a kind of a replacement therapy, but we might combine them kind of to speed up the process of reestablishing NCL. So in shorter, it's on the individual basis, as long as needed to reestablish HCl. This is in chronic conditions. For acute conditions, you can use asymptomatically occasionally, and for the yeah, so it either monitor the progress or use symptomatically as needed.
Great. And if you need a general benchmark of thinking, often somewhere between 1 and 3 months, kind of the plan for that, but then monitor as you go along. Okay. Laura is asking, if a patient's using basic tab and finding they're getting a lot of bloating, would Synthium be a better option? The answer is probably yes. And the reason is if they're taking the basic tab, because it's bicarbonate and calcium and magnesium, and sodium, there's a good chance that if they're getting bloating from that or burping actually from that, their hydrochloric acid is low. And so either adding absinthium to the protocol, or maybe taking a break for a short time with basic tab and using absinthium just to get the hydrochloric acid production a little bit more online, they may find that then the basic tab component is not creating any more bloating.
Yeah. And Heather, if they have the inflammation, then they do need the alkalizer kind of to soothe.
Yeah.
So, but if there's no gastritis, obviously there will be, it's better to use absinthium. But if they have inflammation, then they do need the basic tablets,
Mhm.
basic tabs.
So the next question is very similar. How to take absinthium 20 minutes before meals when Alcala powder is meant to be on an empty stomach. So the general recommendation with Alcala powder or basic tab is you take it on an empty stomach
With the warm water.
with warm water. And it doesn't have to be just before like 20 minutes before a meal. Like, at the minimum amount of time you can wait is 20 minutes, because the idea is when you take the alkalizer with the warm water, it's going to be in the stomach, and it takes, up to 20 minutes before it moves into the small intestine, and then that's where the bicarb is being absorbed and becoming the raw material for making hydrochloric acid and other digestive things, and helping to start getting that pH balance happening. And so, what the recommendation would be is, yes, take them apart. So the Alcala could be taken well before any meals. Like, often I recommend first thing in the morning and at the end of the day. Those are tend to be times where people have empty stomachs. And then use the absinthium 20 minutes before, maybe 15 minutes before the meal has happened. As like a clinical pearl, if it's really hard for somebody to take the absinthium 20 minutes and then wait to eat, then ask them to take it 5 minutes before, because it's still getting all the juices kind of moving. And so just work with where the patient is at. Um, okay, you are very welcome, Sarabjeet, for tuning in and all the information. Okay, so we have another question here. Can you use the H. pylori protocol along with conventional H. pylori medication?
I can
If
take
not,
that.
how would you adapt the protocol?
Yeah, yeah. So usually people look for alternative because it's a very harsh protocol. It's a very not easy to tolerate. Antibiotics are very strong, and then if people have an issue with the fungal dysbiosis already, so they get the diagnosis and they are looking for alternatives. For that reason, there is no point kind of to combine the two. Obviously, with the conventional H. pylori medications, you need to support the person. So you need to, but it's hard because everything goes against. So when you take H2 blockers, you're blocking HCl. So there is no point to add absinthium to promote production of hydrochloric acid. If you're taking antibiotic, there is no point to add mastic gum because it does the same thing. Mastic gum has no side effects. Antibiotic will do, and mastic gum will not lead to dysbiosis. That's the reason for antifungal third component of the conventional protocol. So it's either it's for patients to choose one or another. So if they decide go with the conventional, you will need to later on help them to support their gut, support their microbiome. They need a lot of probiotics. If they stop hydrochloric acid, you can do H2 blockers. You can check their hydrochloric acid and see if their stomach acid is adequate or not, and then slowly to use after that use absinthium to promote HCl production. And also if the ulcer is not healed, you can use, we do have the gastro GI, no, the
GI
product
formula.
GI formula, which are very soothing. It's a former Robert's formula. It's a formula with a lot of healing, soothing herbs to kind of support the mucosa in the stomach. Yeah. So I hope I answer your questions. So it's one or another, but after conventional, you do need quite a bit of support, and I will be happy to help you kind of create the protocol for specific patient.
Great, thank you. Um, the next question, do you recommend absinthium and digestive enzymes or either or? Actually, you could, any of the above works. You could use absinthium by itself. You can use digestive enzymes by itself. I think in the cases of people that have low hydrochloric acid and poor digestion, or they're getting a lot of gas and bloating, or they're really smelly gas, and you can just tell that the digestive juices are not as strong, having a combination of both things with absinthium and digestive enzymes is really a really great combination to support getting that whole digestive system back on track. And the person will know. Sometimes people take digestive enzymes and then they stop taking them and then they realize that they were really helping and they were feeling really good on them. So that's a really nice thing. And actually, absinthium is the same way. Okay. So how long is the H. pylori protocol?
Um, Usually, the conventional treatment it's from 10 to 14 days. We recommend with the dosage, we recommend a little bit longer because mastic gum is much gentler. So, Heather, do we have an exact number of bottles to use
Oh, this is a good question. So
for the gastro ease?
yeah, it's six a day. There's 120 capsules, 120 divided by six. So it's 20 days.
20 days, yeah.
Right, yeah. So it often you'd probably need two bottles. You need to probably doing it at least a month.
And also, this is with mastic gum, but I would suggest to continue with absinthium as long as the proper level of HCl is reestablished.
Yeah. Thank you. So Julie asked the question, what is the dose for heartburn acute? So I've just pulled it up here. So it's 20 drops in water, and this could be just like as a single dose, and it should take about 20 minutes to calm things down. If it doesn't, then you would repeat the dose. For some people, maybe they would need to take 30 drops or 40 drops in water at that one time, but it should be symptomatically working very quickly. If not, then you would just repeat it every hour for a few hours. Okay. So the next question here. Thank you for all your questions. I love them. I love that you are all so engaged. Okay, so Sheena's asking the question about Pleo Alcala and basic tabs. If you use the pee or the urine strips and it indicates a more alkaline state, this means you would stop. Okay,
Acid block.
so one of the things to remember, okay, so if somebody's not taking an alkalizer and they have a very alkaline urine, that actually indicates most likely there's something going on. They should be either within normal range, but a lot, like up to 80% of the population actually typically shows that they're acidic. And so then once you start an alkalizer, you're meant to be in a more alkaline state 24 hours a day. And it's for a short period of time because you want to use up all the excess hydrogen ions that are stored in the tissues. So if somebody's actually taking the Alcala or the basic tab and they test their pH, their urinary pH, and it is alkaline, then the product is doing what it's supposed to be doing and you continue on. How you do an assessment is you stop for 48 hours and then you measure your urinary pH, and then that will indicate where they're at. Are their readings still acidic in the first morning and the rest of the day, or have they normalized? And once they've normalized, then you would stop. Um, okay, so the next part of Sheena's question, would it be indicated to use Pleo Alcala for most people who are having HCl issues? In the early stages, absolutely, because one of the things about acid-base imbalance, and I mean, this is a whole other talk that we could do. But over time, the body starts to store more acid. So this is different than toxins. It's hydrogen ions or acids in the tissues. And once the pH of the different tissue starts to shift, often the stomach pH doesn't go more acidic. It tends to go less acidic and more, not alkaline, but the range comes out of balance. So this is how then H. pylori starts to proliferate. Um, so in most cases with most patients or people with hydrochloric acid issues or low hydrochloric acid, then yes, a round of that to start shifting the pH in the body is very called for. Um, it won't create a drop in the pH because the whole idea is you're taking the Alcala on an empty stomach. Um, well before any food, so it doesn't actually have any effect on the hydrochloric acid. When you take it with warm water, then it's just moving through the stomach to get to the small intestine to be absorbed. And then that will help to get that rebalancing started. So, and actually, the bicarbonate component is what creates the raw material to make hydrochloric acid. And so, you don't want to take it when you're eating food or digesting because yes, then it completely shuts down the whole hydrochloric acid production. So that's not the time to take an alkalizer. It's really meant to be taken well before food, and to be able to have that biochemical effect. Okay, so thank you, Barbara. Thank you. Okay, so Julie, any contraindications to use absinthium or Alcala and interactions with medication? So, that's a good question, and we'd have to pull up the label for contraindications or me reactions or with medications. It's very clearly on the label in adverse reactions or contraindications. So, Julie, I can get back to you on that one specifically. Um, there are a few, especially with alkalizing, there's a few, and absinthium, off the top of my head, I don't know. I don't have a bottle sitting in front of me. Okay, so maybe we'll come back to that or we'll answer via email for you. Okay, so Maxine asked the question, for someone
Thank
who's
you,
had
Jen.
H. pylori in the past, but not currently, would you recommend absinthium as a preventative measure?
Yeah. Maxine, in terms of the approach, I would suggest do the test for for the stomach acid and see if they are low or optimal. So if the stomach acid is optimal, then it's not really need absinthium. It's not really needed. They can use absinthium just for the symptomatic, for the boosting of the digestion, but they don't need to be taking preventatively if their HCl is optimal. Obviously, they can also do the breath test for H. pylori infections and see if they're test positive. Then I would say you can do the complete protocol for with the mastigam with gastroease.
Mhm,
But yeah, no absinthium as a preventative for H. pylori if you have optimal level of hydrochloric acid in the stomach.
mhm. If it's not, or there's some other indicators, then definitely they could take a round or two of absinthium, just to kind of tune things up. Okay, so Lillian is asking how, with patients, do they use the detox kit if they only eat one or two meals a day? They can use the detox kit. So it's often recommended to be taken 20 minutes before a meal, because the A hepatica is stimulating the liver and the bile. So in a case like that, they should just take it before their meals. So if they're only having two meals a day or one meal a day, then the detox kit's just going to take a lot longer to do.
Or they can devise those not in three, but in two.
Yeah. Oh yeah, that's actually that's
Yeah,
a very good point as well.
a
So
little bit stronger. Yeah.
great. Thank you. Okay, so we have a few more questions here. Nadine asks the question, without a gallbladder, I take a full spectrum digestive enzyme with ox bile. Which enzymes would you recommend? I don't think I saw one with ox bile. Okay, so this is a good question.
It's a
Yes,
very
it's
good
true.
question.
Our enzymes are, we have, two digestive enzyme formulas, digestozyme and biozyme, and they are plant-based or fungal-based digestive enzymes, so they do not contain hydrochloric acid or ox bile. Um, so just to let you know, we do have an ox bile formula that is in the NPN process. So at some point in the near future, we will have a formula that does have ox bile in it. Um, what you can definitely do is you can use one of our digestive enzymes, and then you could take absinthium before a meal with fat or protein to help get the bile flowing through the bile ducts and then into the small intestine. So that would be a technique to do it, or also continue with an enzyme that does contain ox bile with meals that have fat or protein in it. Okay. So Michelle asked the question, how many months would it be? Oh, H. pylori, um, given it can take up to a year to resolve. How many months would it be to looking at H. pylori protocol?
Yeah, once again, we're going back to the physiology. If the patient is willing to work on reestablishing the proper stomach function, it shouldn't take a year. Usually, we are not suppressing anything. We're just encouraging body to heal. And H. pylori, again, if you see how H. pylori works, creates the problem. H. pylori will bury itself into the deeper mucosal level, into the stomach, and then it's create the inflammation and ulcer, and that's the problem. That's the kind of negative effect of H. pylori. But if we are healing the mucosal lining, if we are reestablishing proper environment in the stomach, H. pylori could be present for a little bit longer, but it will not cause any negative effect. Many people are carriers. Many people have H. pylori, but it never create neither ulcer or gastritis or cancer. But I would say we don't know, and for that reason, breath test, it's a non-invasive method, so we can always ask patients to go back to their family physician and ask to do the test and see how effective we are. There is no, black and white answer. 3 months, 6 months, a year. I don't think it will take a year if we are going supporting the body with the healing process.
Yep, exactly. And back to the whole drainage and detoxification, a lot of the time it's always talked about 3 months and kind of use that again as a marker, and then testing to see where the patient is at after that point.
Yeah.
Okay. Thank you very much, Diane. Um, okay, we have a few more questions here. Thank you, Sandra. Thank you, Thea. Okay, and um,
Would
okay.
this remedy help with ulcerative colitis? Um, no, ulcerative colitis is totally different conditions. If you have a patient with ulcerative colitis, we will be happy to talk to you. We will be happy to suggest you some protocols. So if you are in Ontario, I'll be happy to help. If you're in other provinces, Heather will be happy to help, or we can both collaborate and provide you with the solution.
Mhm. Yeah, I made a note of it, Catherine, for that one. It's definitely, there's other things that are better and not so triggery. Like there's a lot of healing that has to happen with ulcerative colitis, and we can definitely help you with that.
Yeah, in terms of the apple cider vinegar, like stomach acid to digestive food. So apple cider vinegar is a great digestive aid. So it will stimulate digestion, but it will not replace your stomach acid. So apple cider vinegar actually it's acidic, but in a body it's actually transformed into the alkaline substance. So it's great to maintaining the acid-base balance. It's great to support your digestion, but it's not sufficient when the stomach acid is low. It will not uh, on its own stimulate and um, and the body will not regain the proper function. So yes, use apple cider vinegar in your salads. It's a healthy food. It has so many benefits, but we are talking about the therapeutic solutions. This is for, kind of a preventative and healthy lifestyle.
Great, thank you. You are welcome, Nadine. One last question here. Oh, actually, it's a thank you as well. Thank you, Amy.
Thank you.
We're really happy to be here to share our what collective 40 plus years of knowledge. And we're happy to be able to answer your questions so that we're passing our knowledge base from the mentors we learned from on to all of you. So we really appreciate you being here and learning and really feel lots of gratitude about these webinars. And so thank you. All right, everybody,
Thank you.
take care
Have a good
and see
evening.
you
Yeah.
next week.
Okay. Take care.
All
Bye.
right, yeah. All right, bye-bye.